The disease I chose for the research project is hepatitis. Hepatitis is inflammation of the liver, and there are 5 classifications: A, B, C, D, and E. Each classification comes from a different virus or a different reason. Signs and symptoms of hepatitis are the minor signs and symptoms are fatigue, nausea, vomiting, fever, loss of appetite, and then once your liver starts being infected more, there are more severe symptoms, which are like dark-colored urine, jaundice, light-colored stool, drowsiness, and confusion. The causes, hepatitis A is caused by food poisoning or being in contact with someone who has hepatitis A. B can be contracted from childbirth or contact with an open wound or sharing toothbrushes, needles, razors, anything like that. Hepatitis C can be contracted through intravenous drugs, and if you have HIV, if you're born between 1945 and 1965, if your mother had it when you were born. Hepatitis D can be transferred through blood, saliva, or semen from someone who has it. Hepatitis E can be contracted through undercooked meat or being in close contact with an animal that has it, and that one's not as common in the U.S. The diagnostic test, the liver function test, is one main one where they just draw your blood and check for what your liver's producing in your bloodstream. There's an imaging test, which is like a scan that shows the swelling of the liver itself, or the bile ducts and the vessels running through the liver to see the inflammation there. And then a liver biopsy, which is just a minor procedure that you take a small part of tissue and they test it in the lab. For treatment, healthcare providers usually treat hepatitis by removing the stress factors that are causing the inflammation in the liver. They'll ask you to change your diet. They ask you to remove any toxins or alcohol from your diet, and they just do anything they can to take the stress off your liver. Some people can benefit from medications to help with the hepatitis, but some medications manage through changing your blood sugar or your blood lipids. Some types of hepatitis can't be treated but can only be managed. With hepatitis, your liver's already working overtime, so it's important to eat healthy foods and avoid foods that will further damage your liver. Recommended foods to avoid are salty foods, sweet foods, alcohol, not sweet foods, but super sugary foods, alcohol, fatty meat, foods with high dairy, foods with excessive amounts of butter. Foods they recommend to eat are fruits and vegetables, beans, lentils, proteins, whole grains, and coffee and caffeine drinks, but try to avoid sodas. The prognosis, acute hepatitis is usually temporary and can go away, but some can last for months. Chronic hepatitis can go a long time without ever even causing symptoms. Some people might not even know they have it, and it might lie dormant until their symptoms start. Your liver shows damage through inflammation, so it's important to seek medical attention and ensure the health of your liver if you experience any signs or symptoms.